Hi, my name is Timera Ordóñez Diaz, and my project is on simultaneous measurement of muscle activity, kinetics, and pain in women with carpometacarpal osteoarthritis. Briefly, carpometacarpal osteoarthritis, or OA, at the base of the thumb affects 85% of postmenopausal women. There is a disconnect between self-reported pain and functional disability, highlighting a need to understand the interplay between movement and pain, particularly movement-evoked pain or the pain experienced due to physical activity. We hypothesized that compared to healthy adults, participants with CMCOA would 1. Generate lower forces, 2. Activate extrinsic muscles more than intrinsic muscles, and 3. Have higher movement-evoked pain. For this study, we recruited 5 participants diagnosed with CMCOA and 5 healthy older adults. Pain, thumb tip force, and muscle activity were simultaneously recorded from each participant during 4 maximum effort tasks: key pinch, tip pinch, jar grasp, and jar twist. Muscle activity was recorded through fine wire EMG from 4 extrinsic and 4 intrinsic muscles. This data was rectified and amplitude normalized to maximum activation across all tasks for that participant. For force, participants performed each task 3 times and held their maximum force for 3 seconds. To examine the effect of fine wire EMG on force production, we also collected force measurements from 2 of the 4 tasks before and after placing the electrodes. Lastly, for movement-evoked pain, we collected pain ratings before, during, and after each task using a 101-point visual analog scale. We found there were no clear trends in muscle activation patterns across or within study groups, as shown in this spider plot where each color shows a participant. The heterogeneity of muscle activation patterns within the same tasks demonstrates the presence of muscle redundancy in the upper limb. Interestingly, when looking at a representative healthy adult and CMCOA participant, we saw the CMCOA participant deactivating some of their intrinsic thumb muscles. For force, the CMCOA participants generated similar forces as healthy older adults before fine wire EMG, with a trend towards greater forces after fine wire EMG. When looking at the force magnitude broken down into distal, palmar, and radial direction, we saw healthy adults have a decrease of force production, while CMCOA participants held a consistent palmar force during tip pinch. Lastly, movement-evoked pain measurements, we saw a general trend of CMCOA having higher movement-evoked pain ratings with a significantly greater difference during maximum key pinch. We also saw movement-evoked pain was generally higher than pain at rest, meaning before and after the task, for all tasks. Results from the study highlight the need to perform patient-specific analysis to understand the extent to which different levels of force, exertion, and muscle activity uniquely impact the experience of pain. Despite CMCOA participants having increased sensitivity to pain, their force data suggests that they have learned to push through the pain and/or compensate to accomplish tasks. Whether CMCOA participants have found an optimal muscle activation pattern to avoid pain or protect the joint is still unknown. This work is important because merging the established methods in the biomechanics and pain community can elucidate new findings on OA progression, pain, and functional impairment, eventually allowing us to inform and improve targeted treatments that can restore full joint mobility and eliminate pain.